from Memorial University in Newfoundland. Hannah Sparks graduated from Memorial University of Newfoundland School of Music. She's now a third-year medical student at Memorial, and she'll allow me to say that she had a brief stint in my lab in between. She is joined by Jane Gosine, a professor in the School of Music at Memorial, cross-appointed to Community Health and the Humanities in the Faculty of Medicine. She's also the co-founder and director of the Better Breathing Choir. Jane's been with SingWell from the very beginning and has been an inspiration in our best practices, our social prescribing, and I've had the pleasure of visiting her Better Breathing Choir, and it's a wonderful community. Welcome, Hannah and Jane.
No. You're good with it? Yeah. As long as you can see the slides. Okay. Perfect. Okay, thank you. This presentation examines the findings from a recent pilot study that took place in rural Newfoundland and Labrador, looking at the impact of group singing for people living with Parkinson's. Over the past decade, there's been a rapid increase in the use of social prescribing, both globally and nationally. It's currently used in 31 countries and becoming integrated into primary care across Canada. Provinces take various approaches depending on healthcare priorities and systems, funding models, geography, community needs and expertise, but with the shared goal of bridging clinical care and social support, including the arts. In Newfoundland and Labrador, the focus of social prescribing is on supporting seniors, with the hope of expanding the scope of practice in the future. Link workers assigned to family care teams receive referrals from primary care providers, then connect patients with community resources and activities that support patient well-being. Referrals include people who are socially isolated, experiencing loneliness, or living with chronic illness. Group singing has been demonstrated to offer a way to support these individuals. The challenge for us is finding ways to ensure that singing is part of the social prescribing pathways that target those most in need. There's also been a move to use social prescribing to support care partners, the forgotten faces of healthcare. As a recent CISP report noted, caregivers face significant challenges, including stress, burnout, and social isolation, often compounded by limited access to supports. Social prescribing in Canada is a way of addressing the challenges of overburdened health and social services and a response to a paradigm shift that focuses on a more holistic, asset-based, collaborative, patient-driven approach. Research examining the potential benefits of group singing can provide healthcare providers with evidence-based information to share with their patients and create viable pathways for referrals to singing groups in the community as well as online.
Okay, I'm just going to go a little more into the background of the project that we're presenting today. So firstly, Parkinson's disease is a progressive neurodegenerative condition that affects mainly older adults, and the prevalence is growing faster than any other neurodegenerative disease. In Newfoundland, which is where our study takes place, we have the country's, it's a little unique because we have the country's oldest and most rapidly aging population. Also, we have a lot of rural and remote communities, so these people may experience health inequities and difficulties accessing health services. There's thought to be around 1,500 people in Newfoundland with Parkinson's. People with Parkinson's disease and their care partners may experience social isolation. They may kind of withdraw socially as a result of their symptoms, may not be able to participate in their usual social activities, and the responsibilities of a care partner are very time-consuming and demanding. As we know, group singing has been shown to have a variety of health benefits and can increase social connectedness for people with Parkinson's disease. And social prescribing, which we've kind of talked about today, can also be effective in reducing social isolation. So with all this in mind, our research question is, how does participation in a singing group involving social prescribing impact social connectedness for people with Parkinson's disease and their care partners? So just for some context, our study takes place in Corner Brook. You can see there on the map. So Corner Brook has around 20,000 people living there. It's one of the bigger centers outside of St. John's. However, it's almost 700 kilometers away from St. John's, which is where the majority of health services are clustered. So people regularly kind of have to travel back and forth for health services. So the objectives, we wanted to assess the impact of group singing on social connectedness for participants with Parkinson's disease and their care partners in rural Newfoundland. To explore the relationship between social prescribing and social connectedness, and to just kind of more generally investigate some of the barriers and the benefits and the motivating factors for participating in a singing group. So for our methods, we had a mixed methods pre and post design. We started a singing group for people with Parkinson's disease and their care partners. It ran for 8 weeks. We used the social connectedness scale revised before and after participation in the singing group for people with Parkinson's disease, and then after the 8-week period, we had semi-structured interviews for people with Parkinson's disease and their care partners. And then for the data analysis, we used paired t-tests for the quantitative data and thematic analysis for the qualitative. So just a little bit about recruitment. We did work closely with the Parkinson Society of Newfoundland, and that's where they offer a number of activities like boxing, yoga, and they were a really good resource and already were connected with, had a good network of people with Parkinson's disease in the community. In addition, we were hoping to connect with people who were not already associated with the Parkinson Society. So because there is no established social prescribing pathway in Corner Brook, we kind of personally contacted doctors, nurses, other healthcare professionals, put posters around the community, radio interviews, social media posts to try to, like I said, connect with people who are not already members of the Parkinson Society and might benefit from a group such as this. For the structure, we met once a week. Our leader was a certified music therapist who has some experience in neurologic music therapy. So we started with physical stretches, then we had vocal warm-ups, the singing, and afterwards social time with coffee and tea and cookies and things. And no musical experience was necessary to take part in this study or in the group. So for our results, we'll start with the quantitative. So we had 5 participants who completed the social connectedness scale pre and post intervention, 5 participants with Parkinson's disease. So this scale has 20 items on a 1 to 6 point Likert scale, and so the total score is 120. So as you can see, so we examined whether participation in a singing group influenced social connectedness using this scale before and after. So we found that there was no statistically significant change. Most people showed small decreases or minimal change, but one participant did show a notable increase in social connectedness. So we're going to talk about this participant a little bit more later. As for the qualitative analysis, these were some of our main themes. We had 7 participants who completed the interviews. We had 3 care partners and 4 people with Parkinson's disease. These are some of the main themes that emerged. So just to briefly touch on each, almost everyone reported that it was fun and enjoyable. People mentioned learning a new skill, which I think is kind of shifting the focus from losing certain abilities when you have a neurodegenerative condition to something that's positive, which is like learning a new skill such as singing, and something to look forward to each week. Some of the barriers, definitely, we've talked about this today, but a negative belief about your singing ability and believing that you're a bad singer, and so you shouldn't take part in a group like this, or just uncertainty and really not knowing what to expect and what you're signing up for. Facilitating factors, a welcoming group atmosphere, an encouraging leader, which we've seen today, like that can make all the difference, and also just believing in the benefits. Before we started this group, I kind of did a presentation to the Parkinson Society, to the members, talking about some of the research that exists, and I think that even just having someone involved in healthcare, like that's kind of one of the reasons why social prescribing can work, when you have a trusted healthcare professional kind of like recommending this group to you or talking about how it could help you. And just some social considerations. Most of our participants did end up already knowing each other because they were already involved with the Parkinson Society. So this was kind of viewed in a positive way from the participants. They said that they felt less intimidated attending because they knew everyone, but of course this would have an impact on, which we'll talk about more, on how much of a difference in social connectedness we saw in this study. So this is just going to talk about the participant who I'd mentioned earlier. Our goal of this study was to involve a social prescribing pathway. This was more challenging than we had anticipated. It's just very difficult to get in touch with health professionals. So especially when you're just kind of emailing them and calling them and things. So so we did have one participant who was referred to the group by his speech language pathologist. And was not already connected with the Parkinson Society. So I think it's kind of interesting to consider this participant's experience and how it differs to some of the other participants. And also I think it kind of can demonstrate the value of social prescribing. So this person had no previous singing experience and actually had the lowest score on the social connectedness scale to begin with, and showed the greatest change on the scale. He said he didn't have any, like I said, no singing experience, so he said it was an eye-opener for me. I'm not a good singer, so he kind of had that belief that he was a bad singer, and so he didn't think that this group would kind of be something for him. And he also said they're a good group because when I said that I was a Parkinson's person, they really accommodated me. So really just like the kind of supportive aspect of the group was really impactful to him. His care partner kind of talked a lot about the social aspect and said it was a positive experience that she shared with her partner. She said that he really enjoyed the social aspect and it was an out for her as well. And she got to meet people that she already knew and then some new people as well. So overall, some of our limitations, we had a small sample size. Recruitment was a major challenge that we faced because I think mainly because there's no social prescribing pathway, and also just a lot of that uncertainty that exists around group singing. And again, many participants were already socially connected because they were involved with the Parkinson Society, so they may have had high baseline scores. So in the future, I think that having an established social prescribing pathway would address most of our limitations because we'd be able to recruit a larger sample to target those who are socially isolated, and link workers would be able to kind of discuss some of these apprehensions around joining a singing group. So overall, we believe that a singing group is an enjoyable way to be active and involved in your community. It is feasible in rural communities, there's not huge costs involved, and it can work with smaller groups of people, and I believe that not all healthcare services should kind of be clustered in the larger centers, and it has the potential to prevent the negative impacts of social isolation on health and well-being. So that's all. Thank you. Questions?
Just a very broad, open question. How did you, what do you think of the tool you are using? You know, the questionnaire, and maybe you can describe, I'm not sure you described exactly what it is, and if you were to add a tool, which one would you use? This is, okay, it seems to be, you seem to have an answer.
Dorothy, you can maybe talk to the one we chose, and then.
Yeah, so we did choose the social connectedness scale revised. I mean, I definitely think that when we were handing out the surveys, there was some confusion about like the wording of questions that kind of tripped some people up. So I think it would be worth maybe having a look at what other surveys are out there and if they would be better suited. As for which one I would use, I'm not, like I know of like some of the scales that SingWell uses, but I'd have to like do a little bit more searching to kind of like come up with an answer, I think, yeah.
Yeah, and I think one of the challenges with any of these well-being scales is that a lot of people at the beginning will say that they actually feel quite connected, but then when you ask them further questions, you realize that actually they're not quite that connected, and there is actually quite a lot of social isolation, but some of the quantitative surveys don't capture that very precisely. So I think that what's really important is we have time for a qualitative data in that, and they're actually asking people the questions about, you know, how many times they're seeing people, or just having a better sense, more holistically, of what's going on, because I don't think at the moment all these surveys are capturing quite what's going on for people. That doesn't really answer your question exactly.
It does. It's just because we were working on this issue as well, and we were filming, for example. And that's really kind of heavy load kind of system. But still, I think we need more objective kind of data of how well connected they are and if they succeed. Yeah. That was my point, but thank you.
Research methods are not my thing, but just thinking about that issue that where the quantitative measures are not capturing what you're seeing in the qualitative interviews. Do you think if you did the qualitative interviews first, and like people are almost primed to, like, I've just talked about how isolated I am verbally, and now I'm doing this quantitative scale that's asking me about my social isolation, like maybe the scale might indicate less connectedness. I don't know.
Yeah. It may, and I think that's a really good idea. I mean, doing that, and that may solve part of it. The other issue, I guess, is that it's hard finding the people who would benefit most from these programs because they're not already connected. And so it's how to find those people, and then maybe the quantitative measures would actually show more at that point. But, you know, as Hannah said, we found most of our participants through the Parkinson Society, and they were already connected to each other and the society, and we're getting that support. But I'm sure there are lots of people in Newfoundland and Labrador who are isolated and for whatever reason aren't connecting with a group like this, and that's where I see the social prescribing pathways be exactly what they need, because link workers are actually meeting those people because their physicians and other healthcare providers are connecting them directly to a link worker because they're social isolated, not because they have Parkinson's, and that then they can find these ways of being connected. And so what we really need is easy referral forms on things, you know, going back to accreditation, that you could have a referral form on a web page so that people could have that opportunity to be referred directly there, either self-referrals or through healthcare providers, which would maybe give better research, you know, outcomes, but also reach the people that we want to. But that's the biggest challenge, I think. There.
Last question. Yeah.
You've sort of answered this. This was great. What other things do you reckon contributed to more of the people saying that they felt less socially connected? I mean, you've pointed out some of them, like maybe their awareness wasn't there at the present and then they went through this experience, or I don't know, maybe like being part of it makes them realize, I don't see other people. What sort of thoughts did you have going through though? I'd love to know what you noticed or what you're thinking about.
honestly, like, I'm not entirely sure how to explain that. Like, people being less socially connected after participating in the singing group. I'm not sure. Like, maybe was mentioned earlier, maybe the scale. Maybe we could go for maybe a different scale. There was issues with understanding, and a different scale might be better. So it's hard. There's so many factors at play, and this wasn't like a controlled experiment. So there's so much going on in people's lives and things. So we really have no way to know like why that might have happened. I think.
I also think from observation that I don't think they were less connected afterwards. But I think but that's not a scientific observation. But I don't think that going to a group singing activity makes you less connected. So just from my experience.
Yeah, we've never seen this before, I'll say. So this is a one, but I don't know, live and learn or something. So we're going to break. Thank you again, Hannah and Jane.